Hello there. My name is Dr. Dennis Mihalatos, and I'm the Director of Echocardiography at St. Francis Hospital in Roslyn, New York.
I'm Bob Biederman, cardiologist at Allegheny General in Pittsburgh, Pennsylvania, where I'm the director of the cardiac MRI program. It's a 36-year-old female with onset of TIA, loss of strength in the left arm, left facial droop, dysarthria. She's been having sort of quasi-abdominal discomfort for a while, and she managed to say that over the last couple of weeks while training for half marathons, she simply was getting more short of breath just at the time when she thought she should be peaking. And then, just not quite feeling herself. She said, and specifically, I'm having palpitations, I'm having dizziness, especially when I'm exerting herself. So she came in and had some work done. She had had an echo that, interestingly enough, had been read. And here's the images. And I think if you look at this, there's a 3, 4, and a 2 chamber respectively. The heart function looks reasonable. The image quality is far from ideal. We can't see lots of the walls, but there doesn't seem to be anything on first view in perusing these images, but yet the image quality is not what I would call classic. And she went on for her care, and she came back a few days later with an echocardiogram again. And this one I happened to see, and as we're looking at this, again, the first few looks at this suggests that things are okay, not the best quality imaging, but every once in a while there's a little something subtle that seems to flash in and around the left ventricular outflow tract. And on the short axis views around the inferior septum around 7 o'clock, there again is a little extra mobility that just shouldn't be where our papillary muscle should be. So it raised the question that there was something else going on. And as we look at this more in the 4 chamber and the 2 chamber, it becomes a little bit more apparent that coming in and out of view, just subtly, almost at visual resolution, is some additional movements that are in the neighborhood of where one might not think this is all completely trabecular tissue or chorda tendineae or valve tissue, and raise a suspicion there may be something else going on. The apex is not well seen, the endocardium is not well seen, so that naturally in our laboratory should trigger a DEFINITY examination, and in fact it did. And here is what we saw. Without any question, on the first few images, you can see a large mobile mass arising somewhere in the neighborhood of the septum that's flipping in and out of the left ventricular outflow tract. On the short axis views, you can see that as well, moving back and forth. None of these are good signs. Here on your respective vertical long axis 3 chamber views, you can see that there is large mobile masses that are flipping in and around. These are grape-like masses, but in this case, this was definite evidence that there was either a thrombus, a vegetation, or a tumor of some sorts in and around the heart, and it demanded further evaluation. Well, the natural course is she would undergo a transesophageal echo just to simply show you just the predominant space-occupying mass within her left ventricle. There's some obstructive signs that you can see on the 3 chamber view there, and in fact we measured there was LV outflow tract obstruction. So none of this was a good picture. Running the cardiac MRI laboratory, this was a natural place to sort of get some more information that DEFINITY helped point us to. Is this a thrombus? Is this a mass? Is this a tumor of some sorts? And I think these first images on the left-hand side of really a 2 chamber view, you can see that this mass is large, it's space occupying, it's invading the anterior wall, and it is really chandeliering into the left ventricle, sliding back and forth. And you can see it in the modified 4 chamber view as well, large mass here. The images below helps to point out to whether or not there is associated vascularity, and there's some signs here that this is a vascular tumor, which is very helpful to say that this is not a thrombus. So the tissue characteristics on the MRI were consistent with aggressive invasive tumor, and probably, as they typically are in the heart, deadly. So we had this discussion. Remember, she's a 36-year-old, she's healthy, she's running marathons, she just had a child, and she knows that she's got a very grim prognosis. And there was some question whether or not we should just not do anything. She was very, very aggressive and wanted help. Multiple attempts at sort of more non-invasive approaches were instilled, including a couple of catheter attempts at biopsy, which were not successful. A TE-guided pathology, guided biopsy, which came back normal fat, normal myocardium. They missed the tumor. a limited thoracotomy with transcardiac biopsy, came back normal lung tissue. Finally we took her to the operating room, did open thoracotomy, and it did a complete excisional tumor biopsy. The tumor came back diffuse large B-cell lymphoma. It turns out that this is in fact quite responsive to chemotherapeutics and radiotherapy. And so she underwent several courses of therapy and several months of therapy, tolerated all well. Her dysarthric symptoms went away, her stroke symptoms went away. And I'm real happy to report we performed a cardiac MRI in her, and we were able to demarginate the area of the tumor, completely resolved, completely sculpted out. No further evidence of tumor on any of the views here. There's no sign of any cardiac damage here whatsoever. And we repeated an echocardiogram showing complete resolution of this tumor.
Let's review the important safety information for DEFINITY. DEFINITY Vial 4 Perflutrin Lipid Microsphere Injectable Suspension. Indications. Activated DEFINITY Perflutrin Lipid Microsphere Injectable Suspension is indicated for use in patients with suboptimal echocardiograms to opacify the left ventricular chamber and to improve the delineation of the left ventricular endocardial border. Contraindications. Do not administer DEFINITY to patients with known or suspected hypersensitivity to perflutrin lipid microsphere or its components, such as polyethylene glycol, PEG. Important safety information. Warning. Serious cardiopulmonary reactions, including fatalities, have occurred uncommonly during or following perflutrin-containing microsphere administration. See Warnings and Precautions 5.1. Most serious reactions occur within 30 minutes of administration. Assess all patients for the presence of any condition that precludes DEFINITY administration. See Contraindications 4. Always have resuscitation equipment and trained personnel readily available. In post-marketing use, rare but serious cardiopulmonary or hypersensitivity reactions have been reported during or shortly following perflutrin and PEG-containing microsphere administration. See Adverse Reactions 6. The risk for these reactions may be increased among patients with unstable cardiopulmonary conditions and/or with pre-existing PEG hypersensitivity. See Adverse Reactions 6.2. It is not always possible to reliably establish a causal relationship to drug exposure due to the presence of underlying conditions. Please see full prescribing information, including boxed warning, regarding serious cardiopulmonary reactions. Full prescribing information is available at DefinityImaging.com from a Lantheus sales representative or by contacting Lantheus customer service at 1-800-299-3431.